Aki.
Hey.
How you doing?
Good.
Good. How you feeling?
Better.
Better?
Better.
Good. Okay. Well, I'm leaving, and this is gonna be Janice, your nurse for the night. Okay. So I'm just gonna give her a report on you while we stand right here. Okay? Is that okay? Okay. Good. All right. Mr. Joseph Aki, right? Likes to be called Joe for short.
That's what they call me.
Okay. He's a patient of Dr. LaBelle.
Okay.
He was doing well before this evening, but suddenly came short on breath with O2 saturation, dropping to 88% on room air. Increased respiration to 24. He had an elevated heart rate of 115 and a decreased BP of 88 over 52.
Okay.
We've placed him on a 6 liters of oxygen. Let's see right here, 6 liters. Via nasal cannula on O2 saturation, which increased to 93%. With a little anxiety and increased work of breathing. And how are you feeling right now?
Good.
Okay.
Good.
Okay. His background, he's 71 years old.
71 young. Years young.
He was admitted to the spine unit 5 days ago, following a fall from a flight of 3 stairs at home with the T4 and T5 burst fraction hematoma.
Did he have any surgeries?
Yes, he did. He had an emergency T3, T6 instrumentation, and a fusion 5 days ago. His history is significant hypertension. He has diabetes, hyperlipidemia, and a coronary artery bypass graft. And he's managed on Coumadin.
Okay.
His wife, Allison, right? Is that her name?
Allie.
He's his caregiver and healthcare proxy.
Got it.
Okay.
And what's your assessment?
Well, he had sudden episodes of shortness of breath. He was out of bed, avoiding and tolerating regular meals. That is correct, right?
Yes.
Did you ate today, right?
I did.
Okay.
It wasn't bad.
Okay,
It
good.
wasn't bad.
Surgical site is clean, dry and intact, with the Primapore dressing was changed today. He had episodes of dyspnea, tachycardia, and tachypnea, and it started about 30 minutes ago. I want to say 30 minutes ago. Though I'm not sure what his problem is, I'm concerned we might have a pulmonary embolus. I've called Dr. Phillip, the spine surgeon, covering Dr. LaBelle. He was attending another patient, and he said he would call back as soon as possible. I need you to ask him to get a stat chest X-ray and some arterial blood glasses, and to organize for a spiral CT scan.
Okay.
Also, request that he comes to assess the patient immediately. Okay.
Sounds good.
All right, Mr. Aki, you're in good hands now. Okay.
It's been a pleasure.
All right.
Mr. Aki.
All right.
I'll
Enjoy
see
the
you-
rest of
I'll
your
see you a
evening.
little later.
All right.
Okay.
Hi, Dr. Matthews. This is Nurse Janet calling from the 2nd floor medical unit of the University Teaching Hospital. I'm calling about Miss Green in room 405. Hi, yes. Yeah, there are changes to her condition, and I wanted to give you updates on her medical status. Well, her vital signs has been progressively worse each time since admission. She's been sweating profusely and holding her head between her hands. Okay, sure, I can give you a background. Well, last month she had an episode of highly elevated BP noted at a church health fair, and she was unable to tell me what her blood pressure was at the time. But reports that the nurse who took it told her it was quite elevated. She had been instructed to notify her physician, but she hasn't at that time. I'm sorry? Well, she was admitted last night around 8:30 p.m. through the ED following an unexplained fall at her home the day before. No, she's not on any medication at the moment. Right. But on my assessment a few minutes ago, she's been complaining of a new onset headache, photosensitivity, and dizziness. Her most recent BP is 220 over 120, and her respiratory rate is 24. Right, yes. So her vital signs has been progressively worse each time it was taken since admission. I am concerned about her elevated vital signs since admission, and she has a current headache. Right, and dizziness, diaphoresis, along with photosensitivity. These may all indicate worsening hypertension with the potential risk for a stroke. Okay, so what would you recommend for Miss Green? Okay, so you would consider ordering an antihypertensive medication? and also a low salt diet for her at this time. Okay, so as nursing standard practice protocol, I'll be checking on her vital signs every 2 hours for the next 24 hours. And based on her response to the intervention, we can determine how closely to monitor her vital signs for the next 24-hour period. Would you like another update on her progress after the next assessment in 2 hours? Okay, I'll do just that. All right, thank you, Dr. Matthews. All right, bye.
Okay, thanks, Nurse Janet. I'll put those orders in right away, and I'll be up shortly to check on Miss Green. Okay, thank you.
How you doing, Miss Bami?
Hi, how are you?
Good. So, my shift is coming to an end, but I have Taji here. He's gonna be taking over for the next shift. So, right now, I'm just giving a brief report on how you feel and what brought you in, what's going on. So, Miss Bami, she just got back from the radiology unit. She got a kidney scan. So she was admitted 2 days ago with kidney stones. Still hasn't passed yet. So I did a brief assessment earlier, and she's still in a lot of pain. She rated 7 out of 10 on the numerical scale.
Did she say the type of pain?
Yeah, she said it was a throbbing pain. She just received additional pain meds. She just received additional pain meds 15 minutes ago, as per ordered by the doctor.
No, what kind of type of medication is it specifically?
Yes, morphine. So right now, in another hour, she just needs a vital sign taken again and a reassessment of the pain. All right. So Ms. Bombi, do you have any questions while I'm still here?
I'm still in a lot of pain.
All right. So I'll report that to the doctor. Maybe we should prescribe me something else that she may do with the pain.
Okay.
Do you have any questions for Mr. Taji? Do anything you want to know?
No,
All right. So you have a good evening.
thank you.
Nice to meet you. I'll be back shortly.
Okay, thanks.